Welcome, everyone, to our second Universal Healthcare for Colorado Now webinar. Thank you for being patient while we were dealing with the technology to make sure all of you were welcome to the webinar. I am Senator Jeannie Nicholson and the host for today's webinar. I'm a retired public health nurse and served in the Colorado Senate from 2011 to 2015. First and foremost, thank you for being loyal supporters of universal health care. Today, because of your collective persistence, we are here to tell you we are making progress. 30 organizations have joined the coalition to support a better way to pay for health care in Colorado, including the Colorado Nurses Association, the Colorado Dental Association, the Colorado Cross Disability Coalition, and the Colorado League of Women Voters. The Colorado legislature passed the Colorado School of Public Health Analysis bill, and Governor Polis signed the bill into law. With your help, we raised $750,000 to pay for the analysis. Right now, the Colorado School of Public Health is working on that very analysis that we will be able to see by December 31st. And a recent Colorado poll tells us Colorado voters know our current healthcare financing methods are not working to assure all Colorado residents have affordable, comprehensive healthcare throughout their lives. The theme for today's webinar is moral injury. Moral injury is about the sadness and about the frustration and, quite frankly, the anger our healthcare providers are feeling because they know they cannot provide the care that their patients actually need. Our current healthcare financing methods are harming not only our patients, but the healthcare providers.
If we hit the light, once the light.
We are fortunate to have three speakers for today's webinar who will tell you their personal stories. After you hear their stories, I'll describe our strategic plan and how you can help us to create a nonprofit, publicly funded, privately delivered healthcare enterprise in Colorado. And we'll leave 15 minutes at the end for questions from all of you and answers from us. Our three healthcare providers are Dr. Madi Jacobs, Marsha Thorson, and Dr. Amanda Neidermyer. Dr. Jacobs will begin with your story.
Thank you, everyone. I will try to turn my video on, but I have rural internet, so if it doesn't work, I will turn it off, and that's the reason. It's not because I'm afraid I might crack a lens somewhere. So I'm Madeline Jacobs, and I was a rural family doc in Fremont County for 30 years. I'm originally from Boulder, but I've lived down here in Fremont County since 1988. And I absolutely love it down here. When I went to medical school, we were taught that we had chosen a sacred profession to heal the sick and injured. The most important thing was to take care of our patients. Alas, this mission has been twisted and corrupted in the last decades in our country. Today, our healthcare system is the opposite. Its purpose is to maximize profit by collecting money and denying care. People say the system is broken, but unfortunately, it is working exactly as designed. Moral injury is defined as knowing what we need to do and being prevented from doing it. That is what I, like other healthcare professionals, had to deal with, and was one reason I gave up on medicine in 2017. As I felt I might be more effective working for healthcare reform. So currently I'm the head of our local indivisible group, which went from 4 volunteers for my little healthcare group to over 650 in January of 2025. And we've been pretty active down here on all social justice fronts. In addition, I'm on the board and the executive team of the Colorado Foundation for Universal Healthcare. And we are now dovetailing with PNHP for our medical professionals for Universal Healthcare Group. The horror of seeing people unnecessarily suffer and die from treatable disease was toxic, and I felt helpless, trapped, and enraged. For example, there was the woman who came in, pretty young woman with red swollen joints due to new onset rheumatoid arthritis, who had insurance but had a high deductible. I spent several hours trying to find a rheumatologist who could see her without forcing her to pay the thousands of dollar deductible up front before laying eyes on her. There was a young man who ended up dying from colon cancer because he could not afford a screening colonoscopy. There was a woman with the abnormal mammogram who could not afford the, quote, diagnostic, unquote, follow-up mammogram that would allow her to take care of the breast cancer. Unfortunately, the situation's only gotten worse. The profiteers no longer try to disguise their cruelty. The only thing that is important to them is the amount of cash their widget providers can bring in while cutting any resources such as dietitians and therapists and other ancillary professionals who can implement recommended care. Chiding providers if they aren't meeting corporate profit goals, and telling them they need to see more patients in less time while cutting their ability to care for the patients. In fact, patient care no longer holds any importance to them. There is the example of private equity buying up nursing facilities, fleecing the facility to the point of being a shell of its former self, keeping all profit for themselves and selling everything, leaving only the building as a skeletal corpse with no means to continue. There is the example of profiteering hospitals and insurance companies stripping primary care providers as they can make more but higher fees and more, often adrift with no one taking care of their needs. Today, the doctor who is a healer is an endangered species, but only in the US of A. All other peer countries have figured out that not only is maximizing the health of their people good for the people, but it's good for the country and saves money. Healthcare providers are fleeing due to moral injury. Unfortunately, many providers have chosen suicide to escape. Many are choosing to practice in places that actually want to support healers. Canada, for example, is welcoming American doctors, and the number of American providers choosing that escape route has recently increased by 700%. Traditionally, the U.S. has seen itself as a can-do country with freedom and justice for all. Let's hope it can find its way to a more just way to care for us, the American people. Thank you.
Marsha, if you will go next, please.
Yes, hi. I'm dealing with a little bit of a puppy meltdown, so I apologize if you hear some barking in the background. Thank you, Maddie. You hit on a lot of points that I also wanted to touch on. Just so everyone who may not know who I am, I grew up on a cattle ranch in southeast Colorado, very rural area, and currently I'm living in Gunnison County, so still in rural Colorado. I have spent my entire career in healthcare in some form or fashion. I am not a clinician. I've done research at the university. I've done quality improvement. I've done public service in public health and also primary care practice management. The past 16 years, I managed 2 separate independent family practice clinics in Gunnison County. Sorry. where I worked closely with and for my husband, and he is a family physician. These experiences provided us the opportunity to live and breathe the US healthcare system inside and out, A to Z, and truly we gained a vivid picture of our, what I call, or my husband and I call, a dysfunctional healthcare system. Truly every aspect of a clinic or hospital, especially a small one, feels and experiences moral injury. It's especially amplified in smaller clinics and facilities, and magnified in rural communities. For years, I worked in my husband's family practice handling reception, billing, collections, insurance issues, and pre-authorizations. I regularly saw what happened when a patient needed care. The physician recommended it, and the insurer or billing system created barriers that delayed treatment, shifted costs, and left the patient and staff confused and distressed. We tried every single day to do our best for our community. We built relationships with our patients, and we learned about their work and lives and understood their struggles with finances, transportation, habits, addictions, and often unspoken areas of our lives that aren't readily shared. Maddie shared several examples of moral injury, but how do we see it across the clinic? Because it is felt everywhere. It's the receptionist arguing whether the patient's insurance coverage is active, what's owed on their insurance, what their insurance states, or past due balance, and how previous claims were handled. It's the receptionist who sees that a patient needs help, but understands that in America, if free care is given to everyone, then there's no paycheck for them and no job for them, because if only free care is given, if only free care was given, no one is coming to the rescue of the doctor's office to pay for clinic operations. It's the medical assistant and the nurse who's preparing a vaccine to prevent illness or cleaning you up after a gnarly mountain bike crash, who spent days working on pre-authorizations for a patient's inhaler or referral to cardiology for that persistent chest pain, and then feels frustrated, guilty, and helpless when the patient is expressing upset when their insurance doesn't have preventive coverage for the vaccine, or their insurance is a restrictive HMO tied to the university and only works at the university, but they really wanted to get that mountain bike ride in, and they took an unpredictable tumble. So they're angry with the clinic that it's our fault that we can't deal with their insurance. It's getting ugly messages sent to the staff by email or voicemail about why a pre-auth or referral isn't done, not realizing or not caring that we have done our job and we did it promptly. We have no control over their insurance company and the application of their benefits or their policy and the timing of when that all gets processed. It's the injury that the physician drops everything to take care of the little boy who's gray in color. He had a horrid cough and was super lethargic, but was uninsured. The family said they were healthy and they couldn't afford insurance, so they avoided coming to the doctor. But then they're upset when the doctor says the patient needs to be transported emergently to a well-resourced pediatric hospital. And the parents are struggling with the decision of life or death for their child and impending financial distress and ruin. Knowing that the patient needs to be in a detox center, but has no transportation and no money to go to rehab, even though some progress was made, and the patient is ready to go, but has no way to get there or to make it happen. And we don't have those resources in rural areas. Moral injury is also seen by the crying and upset billing staff member who just had a phone call with the patient about their balance, did their best to explain the patient's insurance benefits to them, explained what was documented in the chart, explained insurance jargon, and ultimately was brought to tears by the ugliness of the patient who has misdirected their anger. Moral injury is all of this, and these are just a few examples of what might happen in a single day at the family medicine clinic. I've been screamed at. I've been made to feel guilty about doing my job, handling the paperwork for claim submission and fighting with insurance to get the claim resolved. When the insurance says it's the patient's responsibility to pay, that's what I have to go with. We don't feel good about making money off of taking care of people, but that is the system we have in America. I've told countless patients that we need a healthcare revolution. The US system is terrible. It's so expensive and wasteful. There's better ways of handling healthcare than what we are doing in the United States. Unfortunately, everyone just feels so defeated, angry, helpless, and some just want to stick their head in the sand and not worry about it because, well, they're healthy and they just don't go to the doctor. They probably feel like their insurance works really well for them because they never have to use it. I remember calling patients to follow up on unpaid bills to verify their mailing address, ensure they received a bill, and to collect payment so I could pay my staff and the bills running our clinic, such as rent, the electric bill, the internet, phone bills. Those companies expected to be paid and paid on time and didn't care how we received payment, and that they didn't care that the payment was out of our hands and totally being dictated by the insurance company. And then we're chasing down patients for a cough that they've moved on from they were treated for 6 months ago. Reception staff are often the first to be verbally attacked by angry patients. We understand that some don't always feel well when calling us, but there's no reason to lack civility. The reception staff do everything they can to be a positive face and first encounter for the clinic, and often have nothing to do with the billing side of medicine. They don't want to be enforcing collecting money. They want to welcome you and ensure you have a positive experience. In the United States, insurance companies are a wedge between the provider and the patient. Anger and frustration that patients have about accessing healthcare, being faced with the costs of healthcare, be it premiums, point of service cost sharing, past due balances. They end up blaming the doctor, the billing staff, feeling like we coded it wrong somehow, resulting in misdirected anger that causes incredible stress to those serving and caring for the patient. All of us just want to take care of you. We don't know what your insurance, why it's inactive, what it covers, why the person on the other end of the line with your insurance company whom you've never met, has never been involved in your care, is denying your care and is denying that pre-authorization. It's incredibly frustrating. I want to share, I'll try to make this a brief story that I think really illustrates everything that it's a real story that really I think illustrates everything in regard to moral injury. And this happened probably 12 to 14 years ago, and I still get emotional. There was a young family in our community who had their second little girl. Unfortunately, she was born with a congenital condition that required multiple surgeries upon her arrival. She had a really tough start to the world, and it was an incredibly stressful and fearful time for her parents. Her older sister was quite young and was a really fussy little girl. But she was in daycare, and so whenever she came home, the infant in the fall, it was recommended that she receive the Synagis vaccine. For various reasons, the vaccine needed to be pre-authorized and special ordered with their Blue Cross insurance. The specialist at the large hospital recommended this vaccine. However, it fell to our office, the primary care office, to pursue the paperwork. Our medical assistant immediately filed the paperwork, even before the family arrived home in Crested Butte. Then we all waited. We were screamed at by the parents who were livid with us that we didn't have the vaccine within 2 weeks of their returning home, because that's what had been told to them, that it would arrive within 2 weeks. We were stunned, nothing had happened. In the end, it took 56 days and 25 phone calls from our clinic to obtain this vaccine. We were scared for this little girl, and we were scared for her parents. It was flu season, and we all felt immense concern and pressure to keep this little girl safe and get her vaccinated. We felt furious with the insurance company. We did everything right. We submitted the paperwork well in advance. We followed up time and again, and to no avail. It still took nearly 2 months. We were being verbally attacked and abused by patients who were angry at their life circumstances, her parents, for themselves and their children. We followed up repeatedly. We tried our best to console the family. We were exhausted. We were drained, guilty that we couldn't have done more, but it was out of our control. We were scared for the life of this little girl and felt enormous compassion and empathy for the family and all that they've already gone through in her short life. I am happy to report that we did finally receive that Synagis vaccine, but it was dramatic to the very end. Immense pressure was felt by everyone. I kept checking the delivery tracking, handling phone calls from the parents who were calling pretty much every 15 minutes. Our medical assistant came into the office to administer that vaccine during their non-work hours. This is just one example highlighting moral injury across the clinic. Being in the crosshairs of doing what is right, abiding by the rules of our healthcare system, and experiencing emotional fallout when a patient thinks the office is the cause of a problem that is really built into the system. To cut to the end, Maddie covered a number of the other, Dr. Jacobs, covered a number of the other points I was going to make. It's really important that we change the system, the healthcare system in America. We can start by doing things differently in Colorado. And I would just ask that we all band together to support a healthcare world without the stress of threatened financial ruin for patients and their healthcare team and clinic, and crushing the spirit of those taking care of them, from the receptionist to the nursing and support staff and to the doctors. Thank you for joining us this evening and bearing with me with my puppy who's causing a major ruckus. I look forward to the discussion. Thank you.
Thank you, Marsha. And next we will hear from Dr. Neidermyer.
Hey, I gotta unmute and put my camera on, I think. Thanks, guys. Thank you guys all for being here. I appreciate it. So, Dr. Amanda Neidermyer. I'm originally from Colorado, from the Front Range in Colorado Springs. I'm gonna just go ahead and kind of jump right into my talk. So I'm gonna basically start, well, not basically, I'm gonna start with why I chose my career as a physician. My journey started when I was 17 years old. I had just had my first daughter. I had dropped out of high school. At her first checkup, she was immediately sent to a cardiologist, a pediatric cardiologist in Colorado Springs, where she had an echocardiogram and was then sent to the local hospital and then over to Children's, where she had her first of multiple heart surgeries. During that time, her pediatric cardiologist was just phenomenal. His name was Dr. Duster. He was incredible to us. He sat down with us. He took all the time he needed to explain what was happening, to describe what her heart was doing, what her treatments were, and what how she would recover from her operations and what the next steps would be. Up until that point in my life, that was really unique. It was such an amazing experience and gave me a lot of comfort during that time. During that period of her life and working with him, I knew with utter certainty that I was going to become a doctor. Had no idea how to do it, or the journey it would really lead me on. But 25 years later, I finally I finally completed that journey, I guess, of training and started practice. So I've now been in practice at a small family medicine clinic in Southwest Colorado. It's the town of Bayfield. I've been the only full-time doctor there for quite some time. When I started my career there, I felt really confident. I had developed a lot of skills, a lot of knowledge during medical school and during my residency training to provide compassionate and evidence-based care. And that was my calling. That's all I wanted to do. I was really excited and to be able to provide it to this community. What I really didn't know were the constraints I would be forced to work under to provide that care. During my very first year of practice, I really, really learned these lessons. I'll just give you kind of the top three. There's more, but the first lesson I learned was coding and RVUs. Most people don't know what RVUs are. Stands for relative value units. There's no value in those units to our patients, none at all. Basically, what it entails is me clicking off as many little boxes as I can to code as much as I can to squeeze as much money of that visit so I can meet my productivity quota. Now, each time I'm with my patients, I try to be as present as possible, but still somewhere in the back of my mind, I'm thinking, am I going to bill this correctly? Am I going to click everything that I need to click? Is this going to make a difference? So that way I look like I'm actually doing my job. So that way the insurance companies have to pay what maybe is their fair share, but probably really isn't. Next lesson number 2, prior authorizations. You kind of already heard a little bit about the hell that is from our previous speaker. But basically what I feel is that this is how insurance companies tell me they know more about medicine practice than I do. It's ironic when what they're willing to give away quite easily often isn't evidence-based and sometimes dangerous to the patient. But it's cheap. So, hey, there's that. Next lesson, formulary changes. Every January, every insurance company decides that they're going to go through and change all of the medications that they use to give people, and they're going to cover these ones, but not these ones. This is really exemplified by inhalers for COPD and asthma from January to April. Me and my team spend hours trying to figure out what formulation an insurance company is going to cover for our patient. Doesn't matter which one I pick, it seems, because no matter which one I choose, it's always the wrong one. They can tell me, yes, this is on our formulary, so I choose it. They're like, no, have you tried this one? What about this one? What I think it is, honestly, is that insurance companies have this idea that if people can't breathe, they're going to be a lot cheaper overall. This is really only the tip of the iceberg. That's really the soul-crushing barriers faced every day to do the job that I feel deeply called to and incredibly passionate about. I think this is what leads to burnout, sometimes suicide, physicians leaving the field. This is the moral injury that healthcare providers experience every day. And it isn't just me, it's my staff, including the medical assistants, my nurses, my front desk, everyone working together to try and get things done for patients after facing barrier after barrier after barrier. It's a never-ending battle. And sometimes, the solutions we're given as physicians for this burnout and this frustration is wellness programs, breathing, try some therapy, I don't know, take some more antidepressants. Surely that's the problem. But you know what? No amount of wellness, no amount of therapy is going to fix this. This is my everyday life, my team's everyday life. It was during this last winter, it was really just kind of hitting me really hard. And I was like, what am I going to do? I hate my job. And I don't, right? I love my job. I love my patients. I love what I do. I think there's incredible value in it, but this is so difficult, this system. And how am I going to live with myself? How am I going to channel this anger, this rage? And I think the only thing I have is really advocating and trying to push for some sort of change within our system. I know that individually, I'm not going to have this amazing impact, but I think if I add my voice to the conversation and if we all can work together, we can really change the system. I think it's just going to take time and a lot of work, but I don't think we can give up. And like I said, we have to fight the system. It's unjust, it's ineffective, it harms not only our patients, but it harms our colleagues, it harms our friends, our families, and our communities. And, ultimately, those people who save our children's lives, our families' lives, and our friends' lives. So that's what I got. And I'm hoping that we can, work together and get a lot of support and try and get universal health care for Coloradans as a first step.
Thank you, Dr. Neidermyer and Marsha and Maddie, for sharing your stories with all of us. Now I'm going to share a presentation so you can see that we have a plan. Our plan is to provide high quality, comprehensive health care for all Colorado residents that each can afford. Throughout 2026, our plan is to educate voters about the problems with our current financing methods and help them envision better ways to pay for health care. If the Colorado School of Public Health determines that a universal health care plan is financially feasible when they complete their analysis December 31st of this year, we plan to educate voters and elected officials about the results of the Colorado School of Public Health analysis in early 2027. We plan to poll Colorado voters to learn their views on financing healthcare using a nonprofit, publicly funded, privately delivered healthcare plan. And we plan to win the support of at least 1.9 million plus, 50% plus one of the voters about the benefits of one nonprofit publicly funded privately delivered health insurance plan for all Colorado residents. We plan to educate city councils, school boards, and county commissioners and encourage them to pass resolutions in support of our plan. We plan to lobby the state legislature and governor to pass a bill in the 2027 legislative session to place a measure on the 2028 ballot. And we plan to continue building a strong coalition of Colorado organizations and individuals supporting universal health care. And we need to raise at least $15 million for professional polling, campaign manager, fundraiser, field organizer, marketing expert, and legal counsel. We plan to support national legislation to remove barriers to a state-based nonprofit, publicly funded, privately delivered healthcare plan, and create a transition team to be ready to implement our new plan. Pass a ballot measure to publicly finance a healthcare plan for all Colorado residents. And to do all this, we need all hands on deck. And here's how you can help. You can volunteer. You can staff a booth at your county fair for 2 hours. Write a letter to the editor for your local paper. Invite your neighbors and show a documentary at your local library or in your home. Carry a banner in your local parade. Be a guest on your local radio talk show. Join the Speakers Bureau and talk to your local Rotary Club. And finally, you can donate. You can donate to the Colorado Foundation for Universal Healthcare and/or fixhealthcarenowcolorado.org. And you can donate when you shop at King Soopers. All your contributions, both in-kind, volunteer, and financial contributions, are appreciated. And as Jane Goodall would say, we can all make a difference. And at this time, we will invite you to ask questions of us and do our best to answer your questions.
I have a question. I'm with my friend. I'm sorry, I'm on his name. How are we planning on funding this? Because I know we could do it through taxes, of course. And people are always going to freak out about, hey, I don't want my taxes to get raised. Is it going to be a certain tax, whatever bracket? I'm not sure. I'm just curious on how we can do this in case someone brings that up to me when I talk about this.
Maddie, go ahead. You can answer that question.
I will try, and of course, we have many people on this call who are very good at this. One thing that people always do is that's like the first question that's asked. And what people need to understand is we don't have a written bill yet, though we are working on that, and we are waiting for this analysis result to see if this is tenable in the state of Colorado. The thing that's important is this is being done around the world. And the United States, in the United States, we pay 2 to 3 times more per capita for healthcare for worse care and worsening outcomes. In the United States, we have decreasing longevity and increasing maternal and child mortality. And so people are not getting the care they need. I think that, what we label it is kind of irrelevant. The thing that's important is that in all the countries that have these universal healthcare systems, people are paying less for their healthcare than they are now. And the reason for that is that most of what we are paying, that is more than what other countries are paying, is going to the profiteers who aren't really adding anything to people's healthcare in any case. So, I think that in a way, you need to look at the bigger picture. We have tons of solutions around the world on how to do this. It's just that the greed in this country is preventing it.
And I would add to that legally, and politically wisely, we call this a premium, not a tax. A tax is something that you contribute to your government, and the elected officials decide how they're going to use the revenue they receive from taxes. A premium is different, and that is what we're proposing as a premium, is something that is earmarked, very specific to the purpose that you intend the money to be spent on. So um, the reason that's important is, first of all, because the word tax is a politically charged word for many people. But the other is that it legally and politically is correct to say that we would pay for this new way of financing healthcare in Colorado with premiums that are on a sliding scale based on your ability to pay, and that the money is earmarked only for paying for healthcare. It cannot be used by it for any other purpose, like, oh, let's just take some money from this fund and spend it on a new highway or a new water infrastructure, something different than the people intended. It has to be used specifically for healthcare. So that may help when you're responding to people who are concerned about a tax, is to describe it as a premium that will be specifically earmarked. And as Dr. Jacobs is telling us, it will be um, as good or better coverage than you have now for less money than you're paying now, unless you are extraordinarily wealthy, when you may feasibly pay more, depending on what the analysis shows. Are there other questions? And you can raise your hand, and Kirby can help us look for people who are raising their hands for questions if we miss you, because we want all of you to feel like you can ask clarifying questions, and for that matter, not just questions, it's fine to make comments.
There's some great comments in chat.
Oh,
So,
read those to us, and then we'll go to Les for questions after we read the comments. Go ahead, Kirby.
okay. Let me, okay. Hold on just a sec.
Yeah, there's
Um,
actually 28 in the chat, so you might get Les's question first while he's looking at that.
Yeah,
Oh, good idea. Didn't realize there were so many. Wow. Dr. Ryman, please go first. You're muted.
Thank you. I just have to make a comment about a book that I'm basing a talk on at a local facility called An American Sickness by Elizabeth Rosenthal. And this really dovetails with the talk today, with the the manner of moral injury. And because moral injury is more than just, having a nervous breakdown because you're so tired.
hmm.
And the this book does talk about basically how healthcare became a big business and how you can take it back. The first half of the book talks about all the corruption in the PBMs and hospitals, and how when Obamacare came into being, the way the insurance companies survived or made money on it was to double the amount of money that people had to pay out of their pockets before the insurance company would pay. So the second part of the book, though, is talking about how we can try and deal with this for-profit healthcare system. and it breaks everything down, asking your doctor if their clinic is owned by a hospital, and things that are trying to control the cost. The third thing I'll say is the movie Healing Us. At the end of the movie, after 4 or 5 very dramatic examples of how for-profit healthcare has resulted in deaths of people, including one who didn't have his health and his Medicaid payment up to date, and he sent in the money, but it hadn't been processed yet, so he could never get his antidepressants, and he wound up suiciding because he was so depressed. Simply the paperwork was what killed him. Anyway, after all these dramatic things in this film, Joe Jarvis points out the one most important thing to him is to vote for people who are for universal health care. So I have a dilemma. I have, a lady in my district um, uh, who has been, uh, anyway, who is one of the lesser known people running, but she is for universal health care. So anyway, all I'm saying is I think that this cause has to be put to the top of our agendas. And it's really the big money and the politicians that are holding us back the most. The public is ready for understanding. So all the education in the world is going to have to be supplemented by strong support of people who may not be receiving lots of money from big pharma, like Diana DeGette, who gets money from one of the big drug companies and several others, and has, she's been great, but she doesn't understand the influence of big money. So that's what I have to say, and it's a complicated situation. Thank you for convening this group, Kirby.
Thanks, Dr. Reitman. All right. Are there any other questions before we go to comments and maybe questions in the chat? Go ahead, Kirby.
Rather than me reading it, I would invite everyone who put in a comment or has a new one to raise your hand. We'd much rather hear from you. You might embellish a bit and tell us why this topic is important to you. So please do raise your hands.
Kirby, just why don't you, go ahead, Brianna, please.
Hi. Sorry, I mostly wrote things. I'm actually at a little resort right now, so just want to be quiet on the porch. Um, so I just want to, I can't say the whole thing that I said on the chat, but I do think along with the polling and all the work, doing a collection of healthcare provider stories, written or videos of it to present along with that from local um, people. And Gwen just mentioned what they're doing with the Colorado Healthcare Coalition. But I do think that would be very powerful along with all of the polling. And I've kind of floated that idea with some of my colleagues and things too. So something that's been on my mind.
Thank you. Maddie, go ahead and respond.
Yeah, someone did put the link for Healthcare Now into the chat, and that is a national database. Healthcare Now is a national single payer organization, and they are collecting stories from around the country, which you can submit online, verbally, audio, video, and written. It can be anonymous or not. You can choose to be a contact person, and it's available to everyone in the country. So that is a really good place to put stories as well.
Right now, I just looked. There's only like 6 stories, and most of them are, from 2022, 23. So there's not much that's there. Um, so I think either we encourage people to put stories there that we can use along with it. But just like right now, there's not a plethora of stories there.
Well, that is good to know. We need to improve that or um, create another source for those stories because we know the stories matter a lot. Virginia.
Thanks, Jeannie. I would suggest that something that I feel helps me feel like I'm actually doing something is, all of us are attending candidate fundraisers, town halls, um, so forth, and so forth. And I think it's really important for us to speak up at a town hall or when you're in a conversation with a candidate to lift up this issue. And I did that at a recent town hall with Senator Amabile of Boulder and Senator Coleman, President of the Senate. And not only will you educate those candidates that you're really concerned about this issue and why, but everybody in the audience will be educated. And I have to admit, there were like 60 to 100 people in this venue for this town hall. And as I was asking the questions about whether they would support us if this bill or if our analysis turns up favorable, uh, as I was even asking the question, I swear that I got a round of applause like 3 or 4 times during that. And the answer that I got from Senator Coleman, President of the Senate, was one word: yes. He would be supportive of legislation to take action to make systemic change. And Senator Amabile said, I talked to you about this yesterday and I wasn't quite convinced, but you've convinced me today. And so I don't know what I said differently or whatever, but just keep at it over and over and over again and lift up that, if candidates want money from you, you need to extract a promise from them that they will uh, pay attention to this issue and do what's right when this analysis is done.
Thank you, Virginia. Absolutely. Those conversations with our elected officials and the candidates, even before they're elected, are critical communication. And as Virginia's pointing out, there's an audience there too. They're hearing it, not just the elected official or the candidate. So it's a perfect forum for us. Um, what about other people? Is there someone else, Kirby, that was in the chats that you can call on to ask him if they'd like to speak?
Well, most of the comments in chat were questions, which I think were answered, but I encourage anyone, I mean, certainly you tuned in knowing of someone who received inadequate care, you yourself perhaps, or a young adult who went beyond the age 26 parental coverage, someone you worry about, the folks you pass on the street who may or may not have coverage. Just invite everyone to raise your hand. Tell us what you think.
There was, I believe, an attempt to get a more universal type of um, healthcare, and it failed badly. Yes, legislators may be in favor of this, but why do you think that this time the voters would go for it when they haven't before?
I believe that the voters now are better informed about what's wrong with the way we're financing healthcare now, Many of them have had more experiences with the health insurance companies and the pharmaceutical companies, making it difficult for them to get the care that they need when they need it. And that gives me hope that there are more voters who believe that we should change the way we pay for health care. When we have polled people, what we're learning, Clark, is that we have what I call won the moral argument that the majority of Colorado voters believe everyone should have access to health care. And they now are aware that not everyone does have access. So over the years, all of you as advocates have made Colorado citizens more aware of the problem. But our next challenge is to get more of those Colorado voters to be comfortable with making the change from their current coverage, if they have health insurance, to something that is different and unfamiliar to them. And so we need your help, Clark, and everyone else who's participating in this webinar to step up and help talk to our neighbors, our friends, everyone in Colorado about how we can pay for health care that will cover everyone and provide as good or better coverage for less money. That's the challenge now. I call that the financial argument that we have not entirely won yet. And what I'm saying that is based on the fact that some people are saying to me when I'm speaking to groups, gee, this is a great idea, Jeannie, and you should do this, but don't mess with my personal health insurance coverage because I'm actually happy with my Kaiser plan or my Medicare plan. And so it's now my responsibility to help them understand why they shouldn't be happy with their current plan and how vulnerable they actually are for a problem that could come up in the future, even though they think they have a great plan. And let me tell you one short story. My granddaughter was 10 years old, diagnosed with severe anemia on Kaiser, considered to be a good health insurance plan by some people. And the pediatric hematologist and oncologist at Children's Hospital could not figure out how to treat this anemia. Thank God it was not leukemia, but they were putting their heads together with experts all over the country. They discovered that there was one possible drug that might help my 10-year-old granddaughter who was getting transfusions every other week at Children's Hospital until we could figure out how to actually treat the problem. And Kaiser delayed and tried to deny access to that medication because it was expensive. Finally, with a great deal of pressure, we were indeed able to get my granddaughter Hazel's medication for her. And she is now, I'm happy to say, a very healthy, happy 13-year-old who's no longer anemic. But that I think is, to your point, Brianna, why we need to be telling these stories too, is
That's
that
true.
people need to understand that they are financially paying for advertising and lobbying and huge CEO compensation packages that they wouldn't pay for. The money would just go for healthcare if we can change the system. Gwen, please go ahead.
Thank you.
Yeah, I just wanted to answer to Clark. Now I'm having a dog problem, but anyway, as several people have said in the chat, the previous effort was 10 years ago, and as Kirby said, it probably wasn't as strong as it could have been. But I think the key thing is that things are so much worse now than they were 10 years ago. Healthcare is so much more expensive. The insurance companies have gotten so much better at denying coverage and hiding behind their policies and all that sort of stuff that I think it's unfortunate that things have gotten so bad, but I think that's the reason why we can educate the voters about what's going on and actually expect them to vote for something like this. So I think you should be optimistic about the voters, and I think it's just it's the right time. This is the time for this to happen. Thank you.
Thanks, Gwen. And specifically, I would point out, Clark, that the passage of the big, beautiful bill, quote, quote, also added to what Gwen's point is, which is many people who have been relying on Medicaid and on tax credits through the Affordable Care Act for their private insurance no longer have that. And that's adding to the number of people who now understand what you and I have known for a long time about why we need to make the change. So, Clark, does that help answer the question?
Yes, thanks. Thanks very much. Because that was my big, I was wondering about. Yeah.
This is the first time I've been at one of these webinars, and uh, you know, I have a long personal story of going between uh, health providers to get what I need, but I guess what I'm wondering is if we can get um, training to learn how to talk to people about this. My problem is it's usually just me telling my story, and I think I need a broader point of view um, to be able to show people what we need.
Barbara, we would be very happy to help you with that. I would first say your story is very important to start with because people remember stories better than they remember facts and figures. But being able to follow up your story with, and here's some very specific ways that we can implement this change, is something we're happy to share with you. Um, and because we have your contact information, Kirby and I can coordinate with you and get you some of the resources that you are asking for. Absolutely. Gwen, go ahead.
Yeah, I just wanted to respond to Dr. Neidermyer's question about what happens if the School of Public Health says this isn't feasible in Colorado. And I might mention that Dr. Neidermeyer is my doctor, and I'm really sorry that she's leaving here. But anyway, we don't think that's going to happen. There was a study that was done and released in 2021 where the School of Public Health did a study and said that single payer would not only cover everybody, but save large amounts of money. So we don't think anything has changed over that time period. And we feel confident that the School of Public Health is going to point out how we could do this. So, if they come back and say it's not feasible, then we're probably in trouble. But I don't think any of us expect that.
Yeah, highly unlikely, in my opinion. Marsha, go ahead.
Yeah, thank you. Agree. And I did put my perspective in the chat. I feel like the study is going to better inform me regardless of what the results are. I can't wait to read the report. And if it shows that we can't do universal health care in Colorado based on whatever modeling they've come up with, which I think they're doing a lot of different angles on it to see how it can work. as a possibility. Well, I'll just continue working on finding other solutions. So, that might be a little bit further down the road, but that's the current status quo has to go. It's literally killing us. So the other thing I wanted to mention, the individual who was asking, I'm sorry I missed your name, about some resources and talking points. On the Colorado Foundation for Universal Healthcare, our website, I put it in the chat. We have a whole bunch of resources available, handouts, ready to go, slides, talking points, all kinds of things, educational materials that are readily accessible right now. And certainly Kirby will, be following up, but please, if it's not meeting your need or you're getting questions that you feel like you can't answer, you've got all of us here. Maybe not everybody, but many of us here tonight that are more than happy to help you and answer questions and talk through those tough questions. Because it's deeply personal and people get really feisty, and you can tell I get really emotional talking about my experiences, and I've had countless conversations with patients, and it's heartbreaking because it's very frustrating. And just for the record, I feel like how much everybody pays into our healthcare system, as well as taxes, I think all care at a primary care office should be paid for by the insurance company.
Yes. And part of the problem is that people like me stayed with a particular employer for years just to keep the health insurance because I had a pre-existing condition. And we need to make sure, I thought that by now they had to cover pre-existing conditions, but make people aware of that too.
Yes, one of the things that I think you're pointing out, Barbara, that's important to say to people is that what we're proposing as a solution would mean that it was not tied, your coverage was not tied to your employer. So you could change jobs. You could even be without a job and still have coverage with our plan. So you're not trapped into a position that you don't want to be in. Um, and it's especially important for people like yourself and for entrepreneurs who would like to try to start a new business and can't afford to do that. Maddie, please go ahead.
Amen to that, Jeannie. And what people really have a hard time wrapping their brain around is that when you are born, you are covered until the day you die, if you live in the, where it's offered. And you don't have to re-up it every year. Your employer doesn't have to struggle every year to get their employees covered for higher and higher costs. All that would just go away.
We have a great idea. We just need to sell it to everybody. All right. Any other comments or questions from the group? Well, thank you all for participating, and especially thank you, Dr. Jacobs, Dr. Neidermyer, and Marsha for sharing your stories. We will have another webinar soon to share with you about the impact of our current way of paying for healthcare on businesses in Colorado. So look forward to that webinar. We very much appreciate all of you participating tonight, and have a wonderful evening, and we will see you soon.